If you're in the labor ward, you may come across the patient of placental abruption. There are subtle maternal signs and symptoms that will help us reaching our diagnosis. Coming to the maternal symptoms, there are four prominent symptoms. First one is sudden severe abdominal pain that might be due to the premature separation of placenta that will result in the collection of blood behind the placenta and uterine muscle irritation. This all results in ischemic intense pain. If there is vaginal bleeding, that could be revealed or that could be concealed. If it's revealed, that clearly tells us that blood is escaping through the cervix. And if it's concealed, blood might be trapped behind the placenta and there will be little or no gross bleeding. There could be the referred back pain that might be due to the posterior placenta separating and resulting in irritation of the posterior uterine wall. And if there are reduced or absent fetal movements, that will be clearly telling us that there is severe fetal hypoxia that is resulting in the reduced movements. Regarding maternal signs, there could be the tender, painful uterus that will be due to the blood infiltrating into the myometrium and resulting in uterine muscle irritation and tenderness. There could be the board-like uterus that will be the hypertonic uterus causing continuous myometrial contraction due to irritation of the blood collecting behind the placenta. There is increased uterine tone and frequent contraction that will be the blood acting as a uterine stimulant and causing frequent contractions. There will be the shock out of proportion to the gross bleeding that is largely seen in the concealed internal hemorrhage. If there is tachycardia and hypertension, that is directly related to the maternal hypovolemia. And there could be the associated findings that the tissue thromoplastin being released from the placenta into the maternal circulation that is resulting in the consumptive coagulopathy and refractory bleeding. There could be the frontal height larger than the gestation, concealed blood actually expanding the uterine size. Now coming to the exam one-liner, retroplacental bleeding resulting in uterine irritation and maternal hemorrhage, also placental insufficiency. These are classic abruption signs. There are subtle CTG changes that will help us in addition to the clinical diagnosis. For example, fetal tachycardia, reduced and absent baseline variability, recurrent and prolonged decelerations, sinusoidal pattern, and terminal bradycardia that is likely due to acute severe abruption.